It is only January, but the flu season is already in full force, and doctors say it is going to be one of the worst. ABC 2 News health reporter Linda So is here. And Linda, a lot of cases already reported.
That's certainly right. The CDC says it's already spread to 41 states. 18 children have died. More than 2,200 people have been hospitalized. Joining us this morning to talk more about it is Dr. Kathleen Maithley with Family Care Associates at GBMC. Thanks so much for being here.
Good morning.
So why did the flu hit so early this season?
I'm not sure we know exactly why it's here early, but it certainly is. And we're seeing a huge increase in the number of cases in the last month here in Maryland.
You saw a lot in December.
Absolutely.
Okay. Now, when people are getting the shot, is this year's vaccine, does it seem to match up with the strains that we're seeing?
It does match up pretty well. We never get it just perfectly, but it's matching up pretty well.
Okay. And is the flu shot 100% foolproof? A lot of people think when they get the shot, they're not going to get the flu. Is that true?
It's not true. The flu shot is our best defense against the flu, so don't get me wrong there, but nothing's 100%. So all of our vaccines have some failure rate there associated with them, but it's absolutely our best defense against the flu.
And you hear some people after they get the flu shot, they say they feel under the weather, a little achy, a little sick. They think they get the flu. Does that happen? What's happening to your body after you get the shot?
Certainly, I don't think there's any evidence that people get the flu after the flu vaccine. Whether they feel bad or not, they certainly report that, and the exact cause of that, maybe their immune system's just working a little harder, or maybe it's just their mind thinking maybe they're going to feel under the weather. But they certainly don't get the flu from the flu vaccine.
Got it. And yesterday here we reported about stories in Indiana and some hospitals in New York requiring their hospital workers to get the flu vaccine. Are there policies like that in place here in Maryland?
Sure. Many of the hospitals here in Maryland have those same policies, and those are appropriate to protect the patients that come through those doors. We need to make sure in our hospital settings that as healthcare workers, we're not giving people the flu.
And lastly here, it's only January. We know the flu season typically lasts through February, perhaps even March.
Sure.
Is it too late to get the shot?
No, it still will have some efficacy, and if you haven't got it, I would recommend that you go to see your primary care doctor and go ahead and get that flu shot.
Okay, wonderful. Thanks so much for all that information. We'll have much more coming up in about 20 minutes. Back to you guys.